So one of the most important comorbidities is GERD. So whenever you have GERD, you can also have nocturnal worsening of symptoms, and you can have multiple micro aspirations. You can have micro aspiration that can cause a uncontrolled asthma, whereas it may be just because of GERD. So that is very essential to rule this out. Second is presence of nasal polyp with rhinosinusitis. So this is called as chronic rhinosinusitis with nasal polyps. This is also a very strong association. So whenever you have an aspirin allergy that is there, so that is what is called as a Samter's triad, where we have aspirin allergy, chronic, you have nasal polyps and asthma. Okay, so it's also called as aspirin exacerbated respiratory disease. So AERD. So what is going to happen is whenever you give aspirin, so you are going to inhibit the COX pathway, COX-1 pathway especially. So once your COX-1 pathway is affected, so you are going to increase unchecked increase in the leukotriene pathway. So once the leukotriene pathway is going to be increased, so you are going to get increase in the leukotriene A4, B4, C4. Then patient goes into bronchoconstriction because of your increased in your B4 and C4. So this is aspirin exacerbated disease. So here you can use a COX-2 inhibitor, may be useful. So wherein they are not predisposed here. So that is one more thing. And we saw obesity very strongly associated, directly proportional with the severity of asthma. And many of them have coexisting OSA. So it is one of the treatable traits in asthma. And depression, about 30% of these patients have depression. So it is very important to screen every hospitalization for asthma. It is very essential to look for the presence of depression. Okay, so these are the things that we have been.